Basically, we have a feeding pipe that goes from our throat to our stomach, and that feeding pipe stops working in achalasia. It stops working because the nerves and the muscles that coordinate everything to squeeze the food down, they gradually lose their effectiveness, they gradually lose their squeeze. And just as importantly, the barrier between the feeding pipe and the stomach stops relaxing, stops opening. So you can't push the food down, and it can't get through the hole, so it kind of backs up and gets stuck. And patients will get chest pain, symptoms of reflux. Frequently they'll have vomiting because things just back up, or they'll just stop eating because it doesn't feel good. The gold standard test, once the initial suspicion of achalasia comes up, is esophageal manometry. It's a very specific test with a tube in the nose that measures muscle dynamics and pressure in the esophagus and just past the esophagus. For anybody with achalasia, there are options for treatment, and after diagnosis, there's a discussion to be had. It requires treatment. Treatment is always an intervention, so there's no medicine that can make it better. And we actually don't know how to fix the esophagus and make it squeeze. So what we do is we try to open up that muscle that's blocking the food from going to the stomach. And there's two main ways to do that in kids. One way is to stretch the muscle with a balloon, and that's something that a GI doctor or a surgeon can do. The second option is called a myotomy, which is a surgical intervention, where a surgeon would actually cut that muscle that's blocking things up and let it relax, open it up, so physically things can go through better. But for any patient, they need to hear those different approaches are possible, their parents too, and they need to know what the pros and cons are, and then decide together which one makes the most sense for that particular person.